Thank you to the speakers for coming this afternoon. This session is focusing on innovation to build capacity and to improve health. And we will start, if I could ask you to take 15 minutes, no more than 15 minutes in your presentation, and then we'll open it up to discussion with the committee and with the public. And we're going to start with Peter Singer, who's the CEO of Grand Challenges Canada. And he's coming to us through video teleconference. Peter?
Great, thank you very much. Let me just check. Can everyone hear me okay if I'm on speakerphone like this?
No.
Is that better?
Yes. Much better, thank you.
Okay. So you can watch the video of me holding the phone. So thank you very much, everyone, for inviting me. I really appreciate being here. I had a look at the committee roster, many old friends, and certainly the amazing leaders in global health and development. So it's really a privilege for me to present to you. I've been asked really to talk about some of the lessons of Grand Challenges Canada in respect to innovation, and I wrote these up in an annual letter that I think has been pre-distributed. Could I just get a sense of how many people have actually read that annual letter, because it'll affect how I go through the material?
We have two hands up.
Okay, so that'll affect how I go through the material. So I'm going to spend maybe the first 8 or 10 minutes on some of the lessons that we've learned on innovation, and then I don't know if you do a Q&A after each session, or you want to do the 4 presentations and then have a Q&A. Yeah, that would be helpful.
We'll do the presentations first and then open it up for discussion.
Okay, great. So then take this as the lessons of Grand Challenges Canada, and let me just tell you in a sentence or two what that is. So Grand Challenges Canada supports bold with big impact in global health. It was founded in 2010. We're 6 years old. We've had about $200 million of inputs, that's Canadian dollars, from the federal government in the development assistance envelope. And there's about another $200 million pledged over the next 10 years. To date, we've leveraged about $380 million of tag-along funding at the program, project, and organizational level. That's yielded 700 innovations in 80 countries. And we project that by 2030, those innovations will save 1 million lives and improve 14 to 30 million. And right there, you know that we're solution-focused and outcomes-oriented, if I can say that, and I'll come back to that. And so that's a little bit about Grand Challenges Canada, and it operates in an ecosystem of a Grand Challenges network, along with Gates Foundation, USAID. I know we have Sarah on the panel as well from the Global Development Lab, which is a key partner, and I think you heard from Chris Elias this morning from Gates. And there's about a dozen of these organizations, including some in Grand Challenges China, India, Brazil, Israel, Peru, Thailand, etc. That's the quick snapshot of what I'm about to give the lessons of. Any questions there, kind of factual questions before I go on? Because I wanted you to get a sense of the context from which these lessons are drawn. Is that clear? Is that okay? Can't see the nodding. Yeah. Oh, there we go. Someone's nodding. That's so helpful. The person whose head is right to the back of the camera, who's now just drinking a little bit of coffee, was nodding, and you're the best bellwether in the room. So thank you very much. And your thumbs up. Excellent. So I'm going to watch your body language the whole time. I don't know who that is, but thank you for being there. Because it's hard to be on a video conference, but if you've got a human signal, like the person waving, it's all good. Okay, so now given that context, what are the kind of lessons learned? Firstly, the idea of focusing investment on a grand challenge. So we focused on 3. Saving lives at birth, that's well known to you because the partnership there is with USAID, Gates, Norway, the UK, Korea, etc. Saving brains, which is a holistic approach to child development, and global mental health, which is maybe one of the most neglected challenges in the world. And we put about 50% of our money in those 3 challenges and 50% in an open platform, because our goal is kind of to lay the groundwork, but not to exclude great ideas. And if you look at the Global Development Lab, if you look at Gates Grand Challenges, they've done the same thing. There's the Gates Grand Challenges, and then the Grand Challenge Explorations. There's the Grand Challenges for Development and Give. So it's very useful to have focus, and it's also very useful to have an open platform. And maybe that's all I'll say about that strategic issue. Actually, I'll go to the third issue next, which is source widely and scale selectively. So we create a very significant pipeline. Of those 700 innovations I mentioned, 90% are at the seed level, which means we put $100,000 to $250,000 as a grant into them, and we transition to scale. But namely, we put in $1 million, partnered with another $1 million from somebody else. These are all Canadian dollars. Into only 1 in 10 of those things in the pipeline. And other people, by the way, put money into another 1 in 10. So about 2 of the 10 are scaling. And this sourcing widely, scaling selectively is a built-in way to manage failure and improve value for money. Because 8 of those 10 things, quote unquote, fail themselves without having to kill them. Now, they don't fail because some of them produce knowledge. You find out that 50% of the street food in Dakar is contaminated. In Bangladesh, it changes the sanitary regulations. That doesn't require scale. That's already scaled through policy. But source widely, scale selectively is the second lesson. And in our first 6 years, that first $200 million, we put about 50% into seed, 50% into transition to scale of the money, which, by the way, means you have about 10 times as many seed projects as transition to scale, because the transition to scale costs about 10 times as much. Third lesson is you are energizing a new generation of innovators and social entrepreneurs. I can't tell you how many times people have told me I would never have gotten funded through traditional channels. And we list in the annual letter some examples of social enterprises that we've supported. This is relevant in terms of domestic social enterprises. There's a list of Canadian ones there, and it's relevant in terms of social enterprises in developing countries where you're actually creating sustainable enterprises that are kind of halfway between for-profits and not-for-profits. To take a couple of examples, we supported Worldwide Hearing, which is a social enterprise that did hearing testing for young children in Guatemala. It tested tens of thousands in Guatemala and a few other countries. And then they were supported by a domestic Canadian foundation, actually, to do the same thing with Indigenous communities in Canada, just as an example. Or Legworks, which developed a low-cost prosthetic knee, is starting to sell the knee, has a revenue stream, etc. So you get the idea. But these are not usually well supported by traditional science agencies. Evidence is critical, especially as you're moving from proof of concept to transition to scale, because the first thing you want to know is evidence of effectiveness as you're scaling things. But it is a different flavor that I wanted to mention. And by the way, in our transition to scale, 50% of the innovators are led by women. Something we're very proud of, and we spend a lot of time on gender and gender analysis. So far we've got focus on a challenge, but it's really hedge your bets, because there's some focus, some broad platform. Source widely, scale selectively is a strategy, which many of the groups are doing. Energize a new generation of social entrepreneurs. Next lesson is emphasize outcomes and choose smart partners. So yes, there is a solution-oriented mode that people are getting into, but let's focus on outcomes. How could I say we're going to save 1 million lives and improve 14 to 30 million by 2030? I could say that because what we did was we took the transition to scale, which is about 70 of the 700. We modeled them through 2030. We tested those models. We were actually working with Results for Development, based there in the DC. Some of the folks might actually be in the room. And we added them up. And so that's an outcomes-based, forward-looking approach. That's how we know. And I can break down the 14 to 30 million lives improved into use of toilets, et cetera, et cetera. That's usually not what you have. What you normally have is the paradox of innovation, where the outcomes are in the future. People don't like to model them, or they don't want to go to the trouble, so you default to outputs, and everyone's talking in terms of papers, workshops, things like that. Those things are not as salient to development outcomes. So I'm just really drilling in a little bit to emphasizing outcomes. Choose a smart partner. And by the way, this method has been refined and developed by a group called IDEA, IDIA, which is convened by the Rockefeller Foundation, about a dozen development innovation.
Peter?
Yep.
Yeah, can you put the phone back towards your mouth? Thank you, so we can hear you better.
Sorry, I was getting carried away.
Yeah, thank you.
Okay, sorry about that, but thank you for reminding me. If it trails off, just let me know. And so emphasize outcomes. Choose smart partners is just the idea that we do not transition to scale anything without not only a co-funder, but a co-funder who has something special to bring. Market intelligence. They're sitting on the board. That's what we mean by a smart partner. So that's another lesson learned in terms of transition to scale. Next lesson I'd like to cover, and I'm obviously going through these quickly because I want to stick to my time, is mobilize new resources for scale. And here I want you to think about the ADIS agenda. Basically the ADIS agenda for financing the Sustainable Development Goals said you've got to focus on the demand side of financing. You've got to focus on private sector and companies and domestic resource mobilization to scale. And that's my little one-sentence précis of the ADIS agenda. And obviously implicit in that is shifting from supply to demand pull of innovation, which you have to do to scale because you can't push a string. Now, the problem is there are no real mechanisms for implementing that. So what we've been able to do is kind of implement a transition to scale process where we only fund with smart partners, where we're insourcing both those actors. Example, we did a deal with Philips on Charm, which is a respiratory rate monitor for pneumonia, top killer of kids past the newborn period, kids under 5, and that is a repayable grant. So we give the money to Philips, but they pay us back based on sales and royalties. And there's types of financing that you can do there. Just like to make the point that that's not financial innovation. That's vanilla finance of innovation, which you need to scale with private sector partners. Other people do this as well, but it's an area we need to push into more. But not everything scales, obviously, through private partners. So to take another example, next week I'm going to see the Friendship Bench in Harare, Zimbabwe. If you have a mental health condition in the developing world, you've got a 95% chance of not being diagnosed, not being treated. We first funded a randomized trial that showed evidence that a little bench outside a health clinic where people are referred for the health clinic, usually with somatic complaints, with a grandmother sitting there who's been trained to do cognitive behavioral therapy, think about 6 or 8 sessions, is very effective at improving the mental health outcomes of those patients 6 months later. So we supported the randomized trial. And then we did a deal with the municipality of Harare to scale that intervention to 25,000 people so far in Harare. So if you're in Harare now, you don't have a 5% chance of being diagnosed or treated with a common mental health disorder like depression. You have a much better chance. And that's an example of mobilizing resources from a subnational government to scale, even past the transition to scale phase. We have also supported financial innovations. For example, we were an anchor investor in the Global Health Investment Fund, $108 million fund, structured by JP Morgan, risk guaranteed by Gates in Sweden, that's investing in late stage kind of social impact investing. And we also developed a social impact bond. I'm more mentioning these things than describing them because of time. Social impact, development impact bond to scale kangaroo mother care in Cameroon that is in the Cameroon country plan, where the World Bank, through the Global Finance Facility for Every Woman, Every Child, invested $2 million in outcomes payments. So I'm going to stop there. I've covered 5 of the 6 lessons. The other one is on reverse innovation, but I already gave you an example of it with the hearing screening. And those are some of the lessons we have learned. I guess just before I break, and I guess I have a minute or 2 left. I want to stay with the time and be respectful to the other speakers and your time. I want to say something about the context. My guess is you've probably started to think through the implications of the U.S. election for the future of global health in the United States. Maybe my body language my body language canary in the coal mine would just so indicate whether or not that has happened. I bet you it took you about 2 minutes this morning, because this is, I think, your first meeting past the election. So you don't need some Canadians to go into that analysis in detail. But let me just say something that I think you've probably already come to, which is based on the experience in Canada, in Australia, in the UK, when there is a conservative government, the overall envelope of development assistance may or may not increase. And I don't want to even take a position on that, because we do know, for example, under George Bush, great programs like PEPFAR, and I know one of the leaders of PEPFAR and maybe one of the founders who's sitting right there happened. So I don't want to take a position on that overall issue. You're in a better position to talk about that yourself, and I bet that's almost all you talked about in your two hours of closed session this morning. However, the point I want to make is that whatever the size of that envelope, a cluster of things does relatively better with conservative governments. And that cluster is the one we're talking about. Innovation, private sector, clear outcome metrics, repayable finance so you can get your money back and evergreen it. That cluster of things that's interrelated does better or tends to do better, and this is my observation based on experience in 3 countries, one of which I lived through, in conservative government. Now, you can decide for yourself whether the administration you're about to have is actually a conservative government or not. That's a separate question. But it will have features of that. And just as I look at the situation, I think things like the things we're talking about relatively will do better. I'm not taking any normative positions. That's for you to do as Americans. I'm just making an observation that the types of things we're talking about, that you're talking about here, increased in importance. They did not decrease in importance as a result of the election. And that's the main point that I want to make. And those concrete examples I used, like the deal with Phillips, like the Kangaroo Mother Care Impact Fund, and like a few other examples we could talk about in the discussion period, the BD-Odon device, GSK and inhaled oxytocin. There's other examples of private sector action. I specifically cited the social enterprises, which are also sometimes private sector entities for a reason. I specifically talked about private finance in the analysis that I gave of the lessons. Those things increase in importance is the contention that I would give you within the development envelope, however big that can be. And, ironically, this almost crosses party lines, because it was a week ago or so that Larry Summers was talking in Qatar about, and he had a piece in the FT about this, about the idea that he thought 50% of development assistance should be global goods and not just 20% as it is today. And when you ask yourself, what is a global good? The quintessential global good is innovation, research, R&D, the kind of thing that we're talking about. So, what I'm saying even crosses political lines, but the simple message I want to give is that as a result of the election, the kinds of things we're talking about here and the lessons learned will increase in importance relative to the development envelope overall. I'm not taking a position on what will happen to the development envelope overall or the structure of it, USAID, for example, with respect to the State Department, and that's for you to discuss and deliberate on. And all I would say is you've got a fantastic organization in the USAID Global Development Lab, and that is a place on which I would be placing bets going into the next 5 years. And I know Sarah will be talking about that, so I don't want to steal her thunder. But in your political environment, I'd be placing bets on that if it can be dealt with in the appropriate relational way in respect of new administration. So I think if it's okay, I'll just stop there. I think I've said enough already. I think I've made my point. I'll really look forward to listening to the other speakers. I'll really look forward to the back and forth Q&A. Anyone object if I stop here?
No, thank you, Peter. That's perfect. Thank you very much. Our next